All right, we're back talking with Dr. Gaeta, and we're talking about dental implants. And we're going to talk just a little bit more because it's not just dental implants that you do. So let's do two things real quick here so we don't lose everybody's contact. You have a website.
Yes, I have a website that is, you can go to www.throwyourdenturesawaynow.com, and you can get more information about implant dentistry, and if you have some dentures that you absolutely can't wear and they're sitting in a jar, or you put them in only to smile and see your friends, or I had a patient the other day tell me that she's the one that drives to dinner, so she can be the first one to let everybody out of the car so she can take her teeth out.
Wow.
So there's a lot of people out there, and they know who they you know who they are, and they just become miserable. I had a 90-year-old. Her name was Stella. She'll be back. She went north, and she had her caretaker brought her in, and she had her teeth in her hand, and the caretaker said, "Can you adjust those for me, please?" For her, and then Stella looked at me, and she looked at me with this piercing look and said, "I don't want those anymore." So I put some implants in, and when she comes back from up north, she's going to have fixed teeth that she doesn't take.
Wow, that's amazing. Your phone number, 941?
Yeah, 426-1134, 941-426-1134, Celebrity Smiles. I'm in Northport, and I've been around the area for about 20 years.
Now you do more than just implants as well. So let's talk about that.
Yeah, I'm a general dentist, and I really focus on fear, the fearful patient, the patient that hasn't come in and hasn't seen the dentist in a long time. Their gums are bleeding. They had a really bad experience when they were younger.
Oh yeah.
You know, I'm sure we've all been through that and the horror stories. So, and I did too when I was a younger guy. You know, when I was little, I'll never forget the time when Dr. Klein. You know, I had an abscessed tooth when I was 6 years old, and I just did not want to go to the dentist. You know, coming from a full-blooded Italian family, the way they show love is the mangiare, So I had a lot of cavities when I was younger. So one thing that I realized is that I have a lot of fear, so I can very much empathize with patients.
I would always see that big old needle coming at me, and so I would actually go and get dental work done without the needle because I could not stand. It just freaked me out so bad. Let's talk a little bit about the foundation you have, too. And by the way, if folks would like to talk to Dr. Gaeta, you can call us at 460-1530, 888-434-1530. We'll get to your call in just a second. What about this foundation?
Okay, now my goal is to create awareness in the world about the benefits of implants. And no one realizes that you lose bone. Once you lose a tooth, you lose bone, you constantly lose bone. And you lose bite force. Once you have all your teeth out, what happens is you have an average bite force of 150 to 250 psi, which is pounds per square inch. Okay? Once you take your teeth out, your bite force goes to 50 psi.
Wow.
You only have 25% of bite force. And statistics show if you've had dentures for 15 plus years, you can have a bite force of only like 5.3 psi. So you can virtually not be able to chew at all.
Oatmeal.
Wow.
Oatmeal, you know, and so what happens is, you know, your life expectancy goes down, just like NIH did the study. So what I've done is, you know, I've learned how to sedate. Okay, so I do conscious sedation. So if you come in, what I do is I look at your mouth, give you a full assessment on what's wrong, what needs to be done, how much it's going to be, and then I can do 10 appointments in one. I can sedate you, and if you need some root canals, crowns, or implants, or
whatever happens to be,
cleaning, you know, I can do all that because you know, nowadays it's, you know, and who likes to go to a bunch of different people that you may not even know. So
I understand. Okay. All right, let's take this phone call here and then see if you have a question for Dr. Gaeta. Hi, you're on the air. Go ahead, please.
Post-traumatic stress, even though you brush your teeth, can cause a lot of stress on your teeth, no matter how many times you brush them. But on the bottom teeth, I found something where they put wires to hold the teeth in. Have you heard of that?
Yeah, do you have existing teeth?
Right, they're false teeth.
Yeah, a lot of times you can, if you have existing teeth, you can stabilize them with something called a periodontal splint. Okay, to anchor your denture in, I haven't heard of any kind of wire at all. You usually have to put something in the jawbone, which is an implant, which is a titanium screw, and then you can snap your denture on top.
Sounds
of
like
that.
you need to go see Dr. Gaeta.
Yeah.
Yes.
Yeah, I definitely have to see it. Now that's funny. Everybody has trouble with their top teeth, but I've got enough suction where they stay and they don't come out as those bottom teeth. I mean, I fix it at 3 times a day, and I'm tired of it.
Yeah, and there's absolutely. So, okay.
Very good, thank you. All right, and you can get a hold of Dr. Gaeta. Now, how do you find you over there, Port Charlotte?
I'm in Northport.
Oh, Northport.
I'm right over here. I'm right off of Biscayne and 41. And call the office for directions, 941-426-1134.
Now, how do you spell Gaeta so people can look up your number?
It's Gaeta, Gaeta. Okay.
Like in Gator.
Yeah, like in Gator.
But it's Gaeta.
Absolutely. So, just like the gentleman was talking about, those lower dentures, if they, and everyone knows it has dentures, they move around quite a bit. The upper usually is stabilized. So, a normal treatment is I'll place 3 implants on the bottom and the lower anterior in the front, so they can snap their teeth in and have a better quality of life.
Very good. Dr. Gaeta, thanks a lot for coming in and talking about this a little bit more. Hopefully folks have now been educated a little bit more about what dental implants are, and they can find you over there in Northport. Again, 941-426-1134, 426-1134. You can call the radio station here, and we'll pass that number along to you. Thanks for coming in. Appreciate it.
Thank you.
All right.
All right.